Hello, I am Urologist Ömür Erdem Akkaya. Today I will tell you about two studies. How often do men using anabolic steroids need reproductive techniques in the long term? What are the rates of users encountering infertility? How often do they need techniques such as IVF and vaccination? We will talk about these. In the other study, the question is if there is any treatment other than testosterone for men with hypogonadism. There are two studies on this. One of the studies was done in Denmark. About 500 men participated in the study, and these men were followed up for 10 years. Compared to normal men, there was a 7% increase in infertility. It is not a statistically significant increase. It has been determined that men who use anabolics need auxiliary products and techniques more compared to normal men. It's not talking about the man who constantly uses anabolics here. Here it is talking about men who have used anabolic for a while and quit. The study has the feature of being a first. What is this? When men using anabolic steroids are followed, do they encounter infertility or how often do they need assisted reproductive techniques? This is the first study to evaluate this. That's why it's important. Apart from this, the other study asked, what else can we use other than testosterone in men with hypogonadism? Men with testosterone below 300 mg per deciliter, but also with complaints such as loss of sex drive, erectile dysfunction, low energy, depression, anemia. Human chorionic gonadotropin, namely Pregnil, was used in this study. This study also has a distinctive feature. It is a study among men with testosterone levels between 300 to 400. Why is that? Normally the American Urological Association says, perform testosterone therapy in men with a level below 300. Do not apply to men over 300. But this study emphasizes something. The number of men whose testosterone is between 300 to 400 and who have hypogonadism complaints and symptoms is not rare. We see it often, and how much would these patients benefit from these treatments? For example, if the patient's testosterone is 375, if this patient has these complaints, how would we benefit this patient by increasing testosterone? Here, a result was obtained. Human chorionic gonadotropin HCG treatment was given to the patients for 8 months. The testosterone levels of the patients increased by about 50% on average. It went up to 550. No side effects were observed in any of the patients. In approximately 50% of the patients, all of the complaints disappeared. In the other 50%, some of the complaints disappeared. Good results have been obtained. One of the important points in this study is that when the patient says, I will not lose my productivity, I will not be infertile, I will also take testosterone therapy, the options are limited as an alternative. Currently, human chorionic gonadotropin in testosterone replacement, or Clomid treatment are not included in our treatment guidelines for treatment protocols. Because their studies are limited. This study has the feature of being the first on this subject. Can we do testosterone replacement therapy using human chorionic gonadotropin? Especially in men who don't want to have infertility or testicular shrinkage. I think we can say that a successful result has been achieved. Hypogonadism is something we see all too often. Normally, in studies conducted over the age of 40, the incidence of hypogonadism in men can be observed up to 38%. This is a very high rate, and even after the age of 40, men may still want to have children. At the age of 50, he may want to have a child. It is an alternative study on what we can use instead of testosterone in such men. It is a nice study. Thank you for listening, best regards.